So you want to come in for an evaluation. I thought I would give you an idea what to expect on your first session. On my webpage, there are some papers for you to fill out. It's a patient information packet. There is also a worksheet for your benefit of what kinds of questions to ask your insurance company to see if you may file our treatments together as an out-of-network benefit for you. I will give you a receipt if you wish so that you are able to do that. But I do have a worksheet for you on my website so you know what questions to ask your insurance company. So please take advantage of that. On your first visit, I'd like for you to fill out the packet that I have available for you online. Download that, fill it out. I think it's about 3 pages. Bring it with you for your first session. If you're not able to do that, I can email it to you. And if that's not an option, I'll have it available for you to fill out when you get there. Please plan to arrive about 10 to 15 minutes early, just in case you have trouble finding us, and also so you can relax a little bit before I see you. And if we have to fill out paperwork, that'll give us a chance to do that before your session actually gets started. I do ask that we start each session on time. I tend to run on time. And I like to honor everyone else's time, so I don't want to keep anybody waiting. Your first session will be an evaluation. I look at posture. So we're going to take a digital posture screen. Just about every dysfunction I've seen, we can see lots of clues with our posture. So we'll be doing that first. Then I'm going to assess your body based on the symptoms you give me. We'll look at the area that's bothering you, as well as other areas that can contribute to that symptom. So we may be treating the area that you're experiencing pain, or we may be treating an area that's related to that area. We just don't know until we get in and we assess the soft tissue and see exactly what's going on. The body doesn't hide anything, so I have ways of knowing what to look at. So I'll explain that thoroughly to you when we meet together. You're going to receive some sort of body work during each session. So come prepared. You might want to dress in layers, especially if you have a shoulder complaint or a back complaint, hip or knee complaint. You can bring some shorts to change into. If that doesn't work, if we've got to get the clothes off, I do have a gown for you to wear, or we can just drape you as you would in a massage. You might not be laying still the whole session because I tend to use some movement as well with the treatment. So don't come in and expect to be completely relaxed for an hour because you're going to be working a little bit too. We'll work together at least an hour. That's my minimum treatment time. If you want more time than that, we can do 75 minutes. We can also do 90 minutes. Just let me know when we schedule how much time you want to spend together. Sometimes if we're dealing with a pretty complex issue, we might need more time together each visit. If you're also driving from a distance and you want to get as much as you can out of a session because you can't make it very often, then we definitely need to work longer together so we can address more area and more of the issue each time. I will also set you up on a corrective exercise program. It may not be the first session. Sometimes I like to work with the soft tissue first, get you out of a traumatic state and out of an acute state, and get the body better aligned. But I will eventually put you on a corrective exercise program. It's will be available to you online. If you don't have computer access, or if you aren't very good on the computer, I can also print those out for you too. It is important that you follow those very carefully and precisely because there is a reason that I've given those exercises, especially to you. Okay? Each program is customized for each patient, each client, in order to address the specific issues that we're facing. You will also be able to reach me in between your sessions. I'm available to you by phone. You can text if that's easier, email, or we can set up a Skype session if something is just not feeling right. If you're having trouble with your program, you just want to make sure you're doing it right, we can do that. Okay, I'm here to work for you. I give you my undivided attention when you're here, so I want you to get the most out of it. And I don't want you to wait at home with questions and wonder why you're not getting better or if you're doing it right. I want it to be a productive program for you. So I'm here to help you any way that I can. I think that's about it for the first session. Come with an open mind, because sometimes what you think is the issue may not be the real issue. So we'll be figuring that out together. But I look forward to seeing you. Can't wait to meet you. See you soon.